All right, everybody. With me here is Dr. Kandula, and he is an ENT and a how do you say it?
No, not like that.
Otolaryngol
There,
otolaryngologist.
there you go. There you go. Yeah, otolaryngologist. It's a
Ologist.
mouthful. It really is. But yep, that
We're
is the
gonna call
full.
you an ENT on the show today.
That's the easier version. That's what most people know as is. So yeah.
Yeah. So the reason we're having Dr. Kandula on today is the fact that in our practice as a physical therapist, it's one of the last things people expect they're going to be told or see. But we see a lot of people with breathing problems from the fact that I had a patient the other day that came in, and what we ended up finding was a lot of his orthopedic problems of headaches, uh, neck pain, upper back pain, all came from the fact that he was a mouth breather and didn't know how to breathe properly with his diaphragm, with his nose.
hmm
And that was a big piece of it, as well as when we're looking at the human and not just body parts, but who are you? What are you trying to do with your life? Are you a competitive athlete and whatnot? Especially if you're a bigger individual, we see a lot of people that have poor sleep patterns, sleep apnea, issues with snoring, not getting the best night's sleep, which I wish I could say I have magical hands and we can do all these things to get you better, but we can't actually out rehab poor recovery, poor sleep. So, that on top of the fact that I am someone that has personally been going through some issues with my airways and sinus infections, and just I really can't breathe well through my nose at all, typically ever. So I want to have Dr. Kandula on today. He's someone that is really seeming to be out there trying to change the game of what ENTs do, how they treat the human being. There seems to be this piece where he's trying to get more involved in getting dentistry and the ENT community together. As I've already put in the intro that he's done a lot with his company Advent. So, Dr. Kandula, thank you for coming on the show, and I've got a lot of questions for you today.
Bring 'em. No, thanks for having me.
All right,
Glad to be
so
here.
yes, thank you. So, one of the first things I want to start off with is just breathing in general. It's something everyone takes for granted. If I just come in and tell you your breathing is part of your problem here,
hmm
people typically are going to say, I'm breathing, I'm alive, I'm fine.
Right. Yeah. Well, I mean, part of that is the reality that nobody talks about this stuff, honestly, and it's really just been recently that people really have been. When I say recently, I'd say the last 5 years, probably. I think there's been awareness slowly prior to that, but nowhere near what it is like these days. And and I honestly think we just are scratching sort of the tip of the iceberg as far as how common these issues are and how profound the impact is. And here's I know it to be true because we see it every single day in all of our clinics. This is all that we deal with. All that we deal with are nose and throat issues, specifically breathing issues, and it's. I think what I found is as we've kind of put the flag up and put the bat signal out is that and it's hard to quantify the numbers, but in my opinion, from what I see, it seems like more people have these issues than don't. So this isn't like you're like in some minority of, gosh, I'm having a hard time breathing. And then when you just run the numbers, you say, well, half the population snores, 20% of the population has sleep apnea. 40% of the population has, we call it allergic rhinitis, but allergy issues. You bang down the list of these big pockets of individuals and you add the numbers up and the tally gets close, if close, and then potentially beyond even what I'm describing. And I think part of the issue too is that not only does nobody talk about nobody talks about these issues, nobody really does anything about these issues, and kind of all of that coming together means there's a lot of people walking around with airways that aren't working properly, and they almost have to be lucky to find themselves in a place that recognizes that. And then when those conditions are identified and addressed, only when those conditions are identified and addressed can anything else really be properly taken care of, because life itself starts right at the front. So right at your nose and throat. And if those areas aren't working, nothing downstream is going to work properly.
So what what symptoms or signs will someone have that they have a breathing issue?
It can be, run the gamut. I'd say the most common, the most obvious, is basically somebody just being challenged to breathe through their nose, whether it's day, whether it's night. Um, Physical activity is an obvious one, and meaning that I think if you push yourself past a certain point, yes, your body's gonna hunger for air, and you're gonna drop your mouth open, and that's okay. The more that folks study that, though, the more that they understand that the the want to do that, and the reality for most folks is they drop their mouth open way too early in that process. And so what they found is for endurance athletes in particular is nasal breathing as a primary and only breathing methodology when you're working out is the right way to do it. And there is a point where you kind of your body's feeling like it's fighting itself, and if you can train yourself through that point, you'll be a better athlete. But I guess back to your question, I'd say the simple reality is if you cannot take a full clear breath through your nose with your mouth shut day and night, that's a problem. If you're snoring when you're sleeping at night, that's a problem. If you're stopping breathing when you're sleeping at night, that's a problem. Headache issues can be a variety of things, but I'd say many folks have sinus headache issues. Many folks have tension headache issues that are interrelated to the fact that they're not breathing properly, so forth and so on. And then I think downstream from kind of the obvious that, your nose and your throat are all the conditions that develop when the body is struggling to breathe. And that's where it's tricky. I mean, there are people who have anxiety issues who'd have no upper airway issues. So that happens. But I will guarantee you that if for anybody that we create issues in those areas, even if it's just temporary, especially if it's temporary. If somebody's got say they have normal breathing passages, they're used to a normal life, and all of a sudden we restrict those passageways, and we do that temporarily, I will 100% guarantee that person, the first sense they're going to feel is a sense of anxiety, because the most primal instinct in our body is to breathe. And when those areas are challenged, the alarm bells go off, all the signals, the hormonal signals go off through the body that we're under threat. And so that's a byproduct of this as well. So I guess I can go on and on and on, is like not everything is related to this stuff, but I think the sad reality is if somebody has conditions that are related to this stuff, the only way to get to the root cause is to fix it at its source. And the source for the conditions that we're treating is the nose and the throat, and mainly the nose.
So someone breathing like this,
Yeah, that's
or
not right. That's
if
a
you
problem.
if you sound like me, you have a problem.
Correct. Yeah.
And that's why we're here today.
Yeah.
Um,
Yep.
and so as we talked about behind the scenes there, James Nestor's book Breathe has been one that I'm about halfway through, but there's some very interesting information in there, especially about why we're seeing so many of these breathing issues coming down to the Industrial Revolution and some of the things about the food we eat now being of a
Mhm.
different consistency, and foods aren't hard enough. We're feeding children like Cheerios and noodles
Yeah.
versus carrots.
Mhm.
And so how did all that happen? What are these things that are making breathing issues such an issue these days?
Yeah, I mean, I think a lot of that stuff is theoretical, because the reality is nobody knows 100% for sure. But kind of what you're getting at is the shapes of our faces have changed over time, and really, specifically, if you go back, sort of industrial revolution, pre-industrial revolution, you'll see that our ancestors actually look different. And everybody's looked at old pictures. I don't know that people are conscious of what they're seeing when they look at those pictures. But what you'll see, our great grandfathers and great grandmothers had airways that were proper, and we think that part of the reason why that was is that they didn't baby them from an eating standpoint when they were developing. So, meaning that soft foods cause your jaws, your jaw muscles, and your facial structures to not develop properly. Mouth breathing is a I was going to say a death sentence. It's not that harsh, but I'd say mouth breathing is a guarantee that you're, as a child, mouth breathing as a child, when you're developing, is a guarantee that the rest of your life is going to be stunted 100%. You cannot have a child who's mouth breathing. And when I say mouth breathing, it doesn't have to be 24 hours a day. I mean, any significant segments during the day, that child's airway will not develop properly. Their face will not develop properly. They will not look as physically attractive as they're supposed to look. They will not breathe as they're supposed to breathe. They are going to be much higher likely to have sleep apnea, so forth and so on. And so, I think most people don't recognize that, kind of that snout area, that nose and throat, the middle of your face is the center of reality for you. And those are the passage we call the breathing triangle, which are the two nasal passages in the throat. Those three areas are the only areas the body can breathe through. Breathing should start with the nose. And if it is starting with the nose, the mouth is shut. If your mouth is shut, then all of the structures in that area develop properly. If your mouth is open, everything kind of collapses down. And those things we know to be true because we see them happening all the time. As far as what happened, we think what happened is I guess, because we're developed and we're smart, we think of making life easier for our children. So let's make the food really soft. Let's make sure, they don't choke on things, those sorts of things, which some of that sounds good. But the problem is if you're not developing those areas, they don't develop. The other part of that, we think, is that there's just more irritants in the air, more allergens in the air. We're more sensitive to those things. And so the lining in the nose stays inflamed, and it starts that way in an early age. So when the passages are restricted through the nose and aren't eating things that develop the jaws and develop the muscles and the bones that kind of form those structures, then you create the perfect storm, which creates human beings that are walking around that have airways that are compromised as the common theme. It's not an anomaly. And I'd say my specific example of this is for everybody who's listening who has their wisdom teeth out. That's not normal. Like our ancestors didn't have oral surgeons to take their wisdom teeth out. They had airways and jaws that were big enough to handle all of their teeth. So the fact that it's the normal course of business these days that for anybody in an industrial world to get their wisdom teeth out isn't normal. It's a sign that something's not right. And I'd say a very similar sign is all of the people who need to be in braces, that isn't the way things used to be. So all those crooked teeth are basically jaws that have been formed that are too small, and teeth that are trying to fight their way in there, and there's just not enough room. And so what ends up happening is you end up trapping yourself with an airway that's just not working properly.
Amazing. And what is the cascade of things that can happen from metabolic diseases and issues that create all these downward health cascades that can stem or have a root in breathing that
Mm-hmm.
I think a lot of people don't see. And in traditional medicine, we're just band-aiding all these symptoms like diabetes, high blood pressure,
Yep.
obesity with other things, and no one's really looking at breathing. It took me myself to realize I should probably seek out an ENT
Yeah.
because of my breathing issues, even though I have 6 sinus infections a year that last 3 weeks at a time.
Sure.
So
Yeah.
why is that? Or what happens with all these different things?
Yeah, I mean, you mentioned quite a few of them. I mean, I think, and the most obvious connections are for folks who have sleep apnea. So sleep apnea is when the throat shuts down when somebody's sleeping at night. Some folks do that hundreds of times or 100 times or more every single hour, every single night. If you can imagine that, which is a miserable situation to be in. So for folks who have obstructive sleep apnea that is of any significant severity, the end product of that will be high blood pressure, is likely to be depression, diabetes, heart disease, strokes. These are all, they all get tied in together, and kind of the core why is that at the very time that your body is trying to rest and recover, which is when you're sleeping at night, instead of doing that, your body is forced to fight for its life every single night. And what ends up happening is your body stays on constant guard. So it's never, your fight or flight mechanism gets turned on, and it's constantly turned on, and there's never a respite. So it's almost like when you're awake during the day is the time where you're upright and your airway is the most open. And then, but you're tired because your body's been dragged all night long. And then you kind of drag yourself through the day, go to bed at night, and you're fighting again. And, I mean, it doesn't take, you don't have to have a vivid imagination to kind of see how one night of that, I mean, literally, for somebody who doesn't have sleep apnea, and you give them one night in the body of somebody who does have sleep apnea, and that person will have a vivid description of nightmares that because they have something to compare it to. It's kind of what I was saying before. If somebody has breathing that's normal or somewhat normal, the only way for them to appreciate what life is like for all of the hundreds of millions of people out there who have airways that aren't working properly is somehow to step away into those folks' bodies. But the flip is sort of also true, is if you have these issues and you've always had these issues, you don't know what life is supposed to be like. And so it becomes this abstract thing of like, I know something's not right here. Is it really that bad? Your body's become accustomed to that over time, how much harm is being done. And I'm here to tell you a lot of harm is being done. And the sooner you're able to kind of take or diffuse that ticking time bomb, the better you feel. And, everybody's life is going to end someday. And the more runway you have in front of you, the more important it is to get these issues treated, is sort of the reality. The other part of that is the earlier you identify these issues and the earlier you're able to treat them, the less harmful these things are. Meaning, if your body's breathing properly, then all of a sudden, we see this all the time, is for our folks who come in who have high blood pressure, we find that they have an airway issue, but we fix their airway issue. Now, this doesn't happen overnight, but over the course of usually months, sometimes maybe even a year or two, what we'll see is that blood pressure that was elevated because their airway was broken now gradually is able to find its way down. And that's one component of that. If somebody's got high blood pressure, that's likely a sign that there are other things going on behind the scenes that are also sort of hyped up. And, I guess traditional medicine doesn't do a good job, period, end of sentence. Traditional medicine doesn't do a good job of connecting the dots. Traditional medicine does a horrible job of understanding the impact of the airway. And so the problem is there are folks like you who have to kind of go on your own search about figuring out, gosh, what's going on with me? What's going on with the patients that you're treating? This doesn't seem, this seems like we're slapping Band-Aids on things, and it doesn't have to be like that.
Yeah, so I want to get to my story in a little bit, but some other things I want to get through first. So, um, one of the other things too is just that breathing issue. It might not just cause one issue, but for example, couldn't you have an obstructed airway, you end up with sleep apnea, you're not getting a good night's sleep, so now we end up with metabolic diseases, or the high blood pressure, you're not
Mm-hmm.
sleeping well, you make poor decisions, you're kind of depressed, you end up with diabetes,
Mm-hmm.
um, and everything else. So yeah, and then we end up with strokes, all kinds of other issues that could we have just solved that with breathing. And it's like, why isn't seeing an ENT and screening these things part of general care? And maybe even, not that ENTs are going to be in general practice as your annual physical, but
Mm-hmm.
shouldn't someone be looking up our airway if this is something that could be preventative to so many other issues?
I hope so. I mean, that really is basically my life's mission at this point, is trying to bring these things front and center. I will say that I'm proud to be an ENT, though my specialty has not championed these issues in the way that we should. And I'm trying to pick the baton up and drive it forward, and getting some of my colleagues to kind of see the importance of it. But yeah, I mean, the reality is these issues are foundational, they're fundamental, they're so commonly off track. And if the single medical specialty that is designed to focus on these issues isn't an advocate for the early care and treatment for these issues, it should be no surprise that nobody is an advocate for these issues. So I don't expect, I guess, I don't expect my primary care colleagues to get it if my ENT colleagues and myself haven't gone out and taught them about how impactful these things are. And so I think there's, I mean, I like to do something. I don't like to point blame. And so I am doing something about this, and I will do whatever I can do to make sure that the word gets out. And I will do whatever I can do to make sure that people recognize how important these issues are. But yeah, I mean, I mean, I guess I'd say this one is, I mean, everybody knows kind of how screwed up the healthcare system here is in this country, but this one in particular is not just in this country; it's kind of worldwide. But it's like the first domino, and for many people, so like what you just described is, we spend it's a lot of time, money, effort, frustration, disease, and death that are tied back to these dominoes that have been tipping for years for people. And nobody goes to the very first domino and points the finger back and says, you know, what if we just picked that one up? Or what if we held that one up? And that is the start of the airway. That is the breathing triangle, is what we call it. And, you know, if you're suffering in a life where those other dominoes have tipped, it's never too late to go back to the beginning. You know, I think many people have kids, and I'd say, you know, the younger you are, the earlier you are in the process, and it's easier to kind of go back to that first principle, that first domino, and pick it up. And I guess the challenge is right now there's the status quo dismisses these issues. The status quo doesn't know what to do with these issues. It's not even on the radar screen, really. I mean, as much as I like to think that people are becoming more aware of these things, they're not. I mean, they're not yet. I hope to make it so. But until everybody recognizes how important it is to breathe properly, there won't be the resources that people are looking for. It's kind of this, and it's a circular argument too. And I know it sounds like you've seen an ENT looking at these issues, but I will say, I mean, the other problem, I guess, and I'm doing something about this, not just pointing fingers, is that most of my ENT colleagues are not aware and adept at identifying and addressing these issues. They don't get it either. They don't understand, I guess they don't understand the power of the conditions that they can treat, because if they did, they would be doing more to treat those conditions earlier and in a more effective manner.
Mm. So let's go back for a second. So what is the actual job of the nose? I think a lot of people don't know that. And so something I tell my patients, actually, it's like, look, breathing is an issue. And it's like, you know, you're still breathing, great. But I think we take, is it 20 million breaths a year?
20,000 a day. So I can't do that math, but we'll go
Yeah.
whatever
Let's
that
say
ends up
20
to
million.
be.
Don't take my word for it. But if we're taking 20 million breaths a year suboptimally, that adds up to a whole lot of stress on the whole body, right? So what is the job of the nose to do ideally?
Yeah, I mean, it is it is the HVAC system for your body, meaning, you know, you could breathe. So basically, you have three holes in your body through which you can breathe: your two nostrils and your throat. You could bypass the nose entirely and survive. You cannot bypass the nose entirely and thrive. You will suffer 100%. And even if that's happening during part of the day, your body is suffering. So what are you missing when you're breathing through your mouth? You're missing the humidification function of the nose, the warming of the nose. So the nose is meant to condition the air that you breathe. So when air moves through the nose, the lining and the structures in the nose warm that air, add moisture to that air, create, actually it's a beautiful process. For me, it's beautiful because I'm a nose doctor, but you know how airflow comes through into the body, comes through through the nostrils, goes up. In an ideal world, the sinus passages are open. So some of that airflow is sort of exchanging with air that's up in the sinuses and then heading on back and then moving down in the lungs. And that's where your body actually exchanges oxygen for CO2. The other part of that beautiful system that happens in the nose and sinuses is, there are, and we're discovering more and more of these things over time, but there are gases that are trapped up in the sinuses. They're not trapped, but they're made in the sinuses that when your body takes those things in, it provides your body with a sense of health and well-being, which sounds kind of woo and zen, but it's true. So your body knows and sends signals to the rest of the body when you're breathing through your nose properly, and it knows when you're not. And yes, you can get by and survive without breathing through your nose, but like I said, it's the air that's coming into your body is not conditioned properly, so it's harsh on your body, harsh on your lungs, and then you're losing all the benefit of the nose by itself. So it's possible to live, like I said, without breathing through the nose properly, but it's not possible to thrive.
Yeah, and if you look at the book by Nestor there, there's a lot he goes into, and we learn about this in school too, is the biochemistry and physiology of what happens with breathing and respiration, where we're changing the acidity of the blood and the makeup of CO2 and
Mhm.
O2, and the myriad of things that can go on with or without those proper exchanges
Yep.
of driving anxiety and all kinds of other things. So yeah, we need to take care of our noses there. So uh, as far as that goes, so big things we see, and I'm a movement guy,
Mhm.
uh, but we see movement affected by all kinds of different things.
Mhm.
One of them being breathing. So with anxiety, it's like which came first, the breathing issue or the anxiety, and what should someone try to do about these things?
Yeah, well, and that is, I mean, again, there are some people who have anxiety, they don't have breathing issues. If you have anxiety, whether you have breathing issues or not, one of the if you follow this line of thought, what is a core tenet of treating anxiety if you're having sort of a panic attack or anxiety disorder that's getting ramped up? It always comes back to breathing, always. And why is that? Is that it's the same thing. Breathing is primal. When somebody's feeling anxious, you don't have to have anxiety disorder. You don't have to have panic disorder. Everybody's felt anxious. What happens when you feel anxious? Your respirations speed up. Your body starts breathing shallow and it starts breathing quickly. How can you remedy that? You start taking slow, deep breaths, and you start doing that through your nose. Is how you're supposed to do that. So I guess many times you can figure out why something is wrong when you think about what we do to get it right. And I'd say in these sorts of situations, the very mechanisms that we're using to get things back in order for some people are the same mechanisms that got this thing started to begin with. So, another way to say that, and Nestor did this in his book, is that when people plug their noses, I mean, he did this on purpose. He did this as an experiment. It's a miserable experiment, but he did it. There were all these physiological things that got off track, but the other thing that got off track was his mental health. I mean, he writes about this. He's sort of as he writes, he's almost writing kind of these fever dreams sorts of things of the things that are going through his head because he can't breathe properly through his nose. And yet, I mean, I don't know how he did it, but he was able to put up with that for a long time. So, the core truth is that there are so many people walking around with conditions that are connected back to the fact that they can't breathe properly, and many people go their entire lives that way. And so this happens all the time and people don't know about it. So I don't know how that's the thing that drives me crazy personally, because as a practice, what we do is we provide simple office-based solutions for these issues. That's what we do. So we don't, we typically don't have to take somebody to surgery to treat these conditions. And so we can do in the office under local anesthesia in just a few minutes, something that profoundly changes somebody's life. Yet there are millions of people walking around with conditions that we can treat so easily. So that's what kind of drives me, and both drives me and frustrates me, is that though most people don't have access to our types of services, is just the reality. And I'm trying to change that, but that's kind of where things stand right now.
Yeah, and so those are a lot of pieces to it. And so as far as we talked a little bit, like the allergens in the air, something that we can sometimes do something about. And I've heard different things going back and forth on that, as far as like in some environments we try to keep our air too clean and we're not exposing ourselves to certain
Hmm.
irritants and allergens or pollutants. But the other pieces there is posture and the physical environment we're living in too. So, we weren't created to sit at a desk all day or be at a chair as a student all day. We were, you know, designed to walk, run,
Hmm.
squat, do different movements. So, do you see posture playing a role, especially these days? I know for us as a practice, I think in 2020 and 2021, 60% of my patient injuries were, they didn't know it, but related to poor work home stations, being neck pain and everything else. So, have you seen a correlation there between people's posture and I think we should define here too. I look at a lot of dysfunctional breathing patterns,
Hmm.
being they don't know how to get a full inspiration or expiration. However, have you seen changes with people's airways as well?
Yeah, I mean, the position of a body that is struggling to breathe is head forward. Head forward means that bowling ball that your body carries around on top of your neck is all of a sudden straining the neck and straining everything. The back, all those, all the structures that are supporting that. Head forward is also unfortunately the position that we all get into with when we look at our phones and that kind of thing. So even there, it's like both like it's like two chickens and two eggs is like the places we're putting our bodies is not that as you said workstation, the lack of a awareness or appreciation of the strain of that is problematic. The problem then is compounded by the fact that, like I said, head forward. Like again, there's a few conditions that can happen as an emergency where you can get an inflammation in your airway. Epiglottitis is one in particular where the textbook, like, what does somebody look like when they suffer from that? They call it the tripod position. They're leaning forward. They're trying to open their airway up. So, like we're trained as ENTs, if we walk into an ER and are asked to evaluate a patient who's kind of in a panic leaning forward, that be very cautious because they may be on their last breath kind of a thing. And so you don't have to have an acute episode like that to find yourself in the same position. So most people who struggle to breathe properly through their nose, or sometimes it's both areas, the nose and the throat, are putting themselves in positions during the day that add insult to injury for a lot of the conditions that you're treating. Musculoskeletal, that kind of stuff. And then, again, I go back to this whole, it's like a perfect storm. And then at night, when your body's trying to rest and recover, there's no time for that. We've got to actually fight to keep that airway open. So I think when you think about that, it's like 24/7, 365, your body's needing to contort itself to simply try to breathe. And the end result of that is going to be seen and felt throughout your body. And most people they don't recognize it, they don't appreciate it. And again, I can guarantee you that a typical the healthcare system doesn't recognize or appreciate that either. They're happy to see you for your degenerated discs or your conditions that are a byproduct of this, but they don't know what to do. They don't even know yet how to connect it back to the get go, which is a shame.
Yeah, for sure. Now, something else too is the brain and cognition. So we know a poor night's sleep, we're going to be tired the next day.
Hmm.
But Nestor actually talked about in the book too that they were finding like excessive ADHD in children, as well as delayed brain formation, where they put these rats, they restricted their breathing, and the rats that were restricted, they couldn't find their way through the maze as fast as the rats that couldn't.
Sure.
Um, so I think there's a lot to be said for making sure our youth are breathing properly and in a healthy manner. But is there things we can do as parents of kids to help with that?
Yeah, I mean, I think being aware of it is the first thing. You got to know that it's a possible problem, and then at an early age, some cultures do this as just a passed down habit, which is when they have babies in their societies, they make it a point to, anytime they see that mouth dropping open, that they're making sure that it's shut. Which sounds, I don't know how you say this. That's a good, it's a good little habit for society to have, because it starts very early. But and if it isn't checked very early, then sometimes it's just to the water under the bridge. There's not much you're going to be able to do about it. But recognizing that this is an issue, if you have a young child that you're seeing is mouth breathing during the day or at night, seeing if you can do what you can do to say, sometimes it doesn't unfortunately require nagging or being kind of annoying, is just seeing if they can, hey, can you, whatever, however you want to say it, phrase it to the child, but can you close your mouth and breathe through your nose, that sort of thing. Unfortunately, a lot of times by the time somebody's recognizing it, it's already too far gone. And so meaning that if the structures are already too tight through the nose, where they shut their mouth and they can't get enough air through their nose, they're just going to drop their mouth back open. And I think the challenge there is that there are simple things that we can do as ENTs to get those airways back open. But I go back to, but unfortunately, most of my colleagues aren't really aware of how impactful this condition will be. And so, even if you're lucky enough to see an ENT for a child that is struggling with mouth breathing, it's unfortunately unlikely that ENT, unless they're sort of enlightened to these issues, is going to do much about it. So I think that's my challenge, unfortunately, is it's sort of like, be aware of these conditions, try to prevent these conditions in an early age, seek help if a child is simply unable to breathe through their nose properly. And then when you find help, know that help may not be as aware as you are of these issues. So keep looking until you find somebody who kind of appreciates, understands, and can do something about these issues.
So would duct taping a small child's mouth shut help them?
I would avoid that.
Parents want to know.
Yeah, don't do that. But mouth taping in an adult or anybody whose nose is working properly, it's kind of become a bit of a fad here these days.
Mm-hmm.
So I'd say if you're grown up enough to know that you can breathe through your nose properly, then you can experiment with some of that stuff. Do not do that to a young child. You'll regret that. So yeah.
I'm just joking, guys out there.
Yeah, don't do that. Yeah.
But that does bring something up that I want to go over too. So Nestor kind of talks about he always had these breathing issues, and he makes it sound like in the book that there is something we can do on our own proactively to change what is happening to our airways. Do you agree with that? Do you not? Is there some gray area there?
There's
I
a
mean,
great,
if
yeah.
it's so there's bony anatomy.
Mm-hmm.
Like I've learned, there's there's the bones of the nose and the airway and everything else, but there's a lot of soft tissue in there too that contracts, shrinks, expands all through the day.
Right.
So someone like me that can't breathe, do I have hope to possibly do some of these? Tape my mouth shut, force my nose to be the one to expel and inspire air, and see progress.
You could try it. You can try it. As you just said, it depends on what's going on. So, how I phrase it is, if somebody's got a nose problem, they either have an anatomy problem or a lining problem or both. And so, then if it's an anatomy problem, if it's a deviated septum or there's structures in the nose called turbinates, which are humidifiers. If they're too big, if the sinus passageways are blocked off, you can sort of close your mouth and try to breathe through that nose as much as you want. And you might inch the ball forward a bit. You'll never create truly open anatomy through there. That's the reality. You cannot change, shut down, bony or cartilaginous nasal anatomy by mind over matter. It's not going to happen. If you've got some, if it's passable, like it's kind of open, and maybe you've got a little bit more of a lining issue than an anatomy issue, then yeah, keeping your mouth shut, just so everybody knows what position should your body be in as far as breathing goes. Your mouth should be shut, your lips should be touching, your teeth should be gently touching, your tongue should be plastered to the roof of your mouth. There shouldn't be any air between your tongue and the roof of your mouth. So that's how your mouth should be held, and then you should be able to breathe comfortably through the nose. If you practice breathing exercises, part of what you're going to do is put your mouth in that proper position, but then you're at the mercy of the passageways that you have. And, I think with through breathing exercises, some people can make things more tolerable, maybe a little bit better. But if the true issue is anatomy, you're kind of fooling yourself if you think that the end result of that is going to be a truly proper airway. It'll be an improved airway from what you had, but it won't be what it's supposed to be. And again, in the book, and Nestor talks about this, is it sounds like he's got a deviated septum, turbinate hypertrophy. He's got some sinus issues based on my recollection of what he's describing. And, yes, while he went and did some of these breathing exercises, I will never seen a scan, but I'd say I will guarantee that with simple maneuvers, we could make that anatomy much more open. And to me, the right order is get things open. They don't have to be perfect, but they need to be functionally open. And then do the breathing exercises. You could try them on the front end. If you don't have access to sort of the simpler solutions to get some of these airways open or these areas open, you could try with the breathing exercises, but don't be surprised if you end up frustrated. And I mean, at the end of the day, most people who are doing things that aren't giving them results end up stop doing those things after a while. So it sounds great, but why would you do something that isn't giving you the results that you're looking for? And I would say for most people, unfortunately, it doesn't. If for those that are advocates of these sorts of things, I guess I'd say they're fortunate that these things are doing more than they do for most.
Mm-hmm. And so talking about the lining versus anatomy, right? So, there's all kinds of, you go to CVS and there's this whole, display of thousands of items on the wall there. And so, a couple of years ago, I literally couldn't breathe through my nose at all with a sinus infection. Like, it was like a struggle to just be awake. Sure. And I discovered Afrin. And it was like, oh my God, this is what life is supposed to be like?
Sure. Yeah.
And even now, if I get one, like, I basically have to use that to function through the day and just be able to talk to my patients and not have my eyes feel like they're blowing out of my head. So in that case, with that, if something like Afrin works for you, not that it's good for you, but does that put you more in line of you have a lining issue versus an anatomy issue?
No, is my short answer. So Afrin is a powerful decongestant. Most of the time what I say, my party line is that if you have a lining issue, that's what the medications are for. That's what they're trying to treat. So the allergy medications, allergy nose spray, those sorts of things, they're mainly, they take the edge off of inflamed lining. Afrin is a decongestant. So what Afrin is doing when you spray that in your nose is the turbinates, which are the humidifiers, which most people don't know that term. Anybody who's ever suffered with a nose that's stuffed up knows the misery of having turbinates that are too big. Some people have turbinates that are too big chronically. So if you are in that condition, you spray Afrin in your nose, it's going to shrink the anatomy down temporarily. So you'll get it's meant to be 12 hours. The more often you use it, the shorter the duration is. But the airflow that you experience when you spray Afrin in your nose is how do you say this? It's as close to what you might feel if the anatomy were open like it's supposed to be that you'll get, but you can't get, but the Afrin,
yeah,
it's a Band-Aid. You end up, chasing your tail on that. But that basically, I'd say that whatever that feels like, and for many people, it feels like an epiphany, like the hand of God has touched them and you're breathing freely. that's normal. Like that's what most people who have normal airways feel like. So the fact that for you it feels like, God has come down and touched you on the shoulder is a clear sign that you aren't built properly. And so, for us, we don't need the hand of God. We just need our simple, tools in the office. And for us to reduce the turbinates, so make them smaller, is something we can do. Like I said, under local anesthesia, it's a 10-minute procedure, and we can create that effect, create that open anatomy on a permanent basis. So anyway, yeah.
Okay, very very interesting. Now, snoring is another big one. So, snoring, I'm pretty sure it's highly correlated with sleep apnea, but there's plenty of people that snore that don't have sleep apnea, correct?
Yeah, that's true. Yeah, exactly. Pretty much everybody who has sleep apnea snores. Most people who snore don't have sleep apnea. You can't know which category you're in if you don't have a sleep study. You can think you know, but you don't know. And it's so easy nowadays to do a sleep study. We do them at home. You do them just in your bed. There's no reason not to get that information. But while sleep apnea definitively is, it can be deadly, it always is going to create some other issues that are there. Snoring by itself isn't necessarily deadly, but it does cause harm to your body. So snoring, I mean, it's certainly annoying for you and those around you. So there's that aspect. But the sound of snoring is the sound of your throat vibrating. And then for folks who have sleep apnea, it goes to the extreme where everything's shut down completely. But that shouldn't be that way. That the way I describe it is snoring is the sound of your airway crying when you're sleeping at night. Your airway's crying. It wants to stay open, but it can't stay open. And then sometimes it'll shut down on you.
And so, even snoring itself probably isn't the most optimal thing, like to
Mm-mm.
experience as a person. It's kind of, it doesn't sound relaxing. I actually have a sleep app on my phone now, and I'm like, this does not sound like I'm restfully, peacefully sleeping and getting a good night's sleep.
Yeah, absolutely. Well, I mean, I guess on all of these subjects, is there anybody in the world who, if given the choice, would snore and be a snorer? Because I don't think so. I think that population is zero. Yet half of the adult U.S. population snores. So there's a disconnect there where and if you follow the ball there, if somebody's sleeping next to somebody, so almost everybody in the adult US population is either personally suffering from snoring or being affected by snoring in the bed, meaning the person next to them. So like it's a very, very common condition and nobody likes it. Nobody wants it. Yet I think obviously, given the fact that it's so common and that nobody's, been able to, or is accepting it the way it is, people have are just sort of saying, I guess this is how life is supposed to be. It's not normal, and it definitely is disruptive. It will disrupt your sleep. The person who's snoring, it'll disrupt their sleep. Although many snorers say, "No, I sleep fine." You don't sleep fine. You just you think you sleep fine because that's the only way you know how to sleep. But if you slept without snoring, not only would you be happier, the person next to you and those maybe in the next room next to you would be happier too. I mean, this is where it's kind of a weird concept. Is many people, if you live in kind of the human meat sack that we all live in, is that over the course of your life, you're going to have medical conditions that develop in various aspects of your body, and you're going to need care and treatment on all those sorts of things. And I can't think of another one, but I'll say this, and maybe you can, but I'd say snoring is the one condition that I know of that not only affects your body, it affects those around you, and really it is a wedge in relationships. People literally get divorced because one of the partner snores, or that kind of thing. That happens all the time. And the sad truth is nobody wants to be a snorer. Nobody wants to be a snorer. Nobody wants to sleep next to a snorer. And what other medical condition does somebody get ostracized for the fact that they have this medical condition? I mean, there probably are some halitosis, or there's some of these things, but snoring is one of those. You know what I mean? Like who you like a normal polite people don't call other people out because they have diabetes, as a specific example. You're not like that. That doesn't happen. But I guarantee you that right now somebody's getting called out because they're snoring, and they didn't ask to be a snorer. It's not with the condition they want. but it's what they got, and that is a weird dynamic with that condition.
I'll tell you all about it right now. Here we go. uh, so that being said, so with snoring too, so say I use Afrin, I'm like, okay, I need a great night's sleep. I'm gonna have some Afrin. I'm breathing great. I think my airway is open.
Mm-hmm.
I put my sleep tracker on. I'm still snoring like a chainsaw. Why?
Well, the sound of snoring is coming from your throat. That's where the sound comes from. Your airway starts with the nose. I don't know. I don't know the truth for you, but I would imagine that when you use the Afrin, you feel like you're sleeping better than you would if you weren't using the Afrin. But if the snoring is still persistent, whether you do or don't need to use the Afrin, then your throat is shutting down. It's too small for the body. So, I mean, the start of your airway is the nose, and your throat needs to be open when you're sleeping at night. And in an ideal optimal world, nose is open, throat's open, you're sleeping peacefully, quietly. That's where things are supposed to be. If you've got both of those things in play and we get the nose working better, let's at least half of the weight off of the system, but you still got this throat issue. So generally speaking, like in a condition like yours, we would just sort of evaluate the whole situation. What's going on nose and sinus wise? What's going on throat wise? Typically do a sleep study to make sure we know exactly what's going on there. And then, there are simple things we can do nowadays to get the nose and sinus areas open that don't involve surgery. And again, with the throat, it just depends on the situation. There are simple things we can do there. There's something called an oral appliance, which is like a retainer that you can wear when you're sleeping at night that just basically gently keeps your mouth shut, pulls your lower jaw forward. Your lower jaw is attached to your tongue. So when we pull that jaw forward, your tongue gets out of your airway. So a nose that's breathing properly combined with a throat that's open is, generally speaking, a quiet and peaceful sleeper and a happy household.
And now, could it take time too? Because I feel like could snoring be like a learned behavior over time where say I go get a sinus surgery or the turbinate reduction, whatever. I could should I ideally, if it's just my nose that's the issue and blocked, should I stop snoring right away? Or is this something there's some practice of maybe, mouth taping and things like that to get rid of those habits essentially?
Yeah, it depends, but yeah, both. How do you say this? In that situation, we would get the nose open. Our approach is typically to do a sleep study up front, so we know the extent of the throat issue. So, meaning we'll know or have a very high degree of predictability whether we think getting the nose working is going to likely get you out of this situation or whether it's going to be a 1-2 punch kind of a thing before we do anything. But let's just say it's sort of borderline or we're not quite sure on the throat part. Then yeah, we would get the anatomy open in the nose and sinus airways, get you landed on the back end of that, and then see what the results of that are. And yeah, some folks do need to kind of train their bodies to breathe through the nose because they're not used to it. And so you got, how I typically describe it is that somebody developed a habit out of necessity. When we take the necessity away, you're still in the habit. So we have to create behaviors that or tools that get rid of that habit, which can happen. I mean, people can learn how to breathe. Again, back to the earlier question we were talking about, which is if you have the proper tools. Then absolutely do what you need to do to learn how to use them. Breathing exercises, keeping the mouth shut, mouth taping, all good. If you don't have the proper tools, it's a waste of time, effort, and energy to try to breathe through a nose that just doesn't have enough passageway. I mean, this isn't like, high level physics or rocket science. It's pretty just simple. Like if the passageways aren't open, it's not going to work for you. So, yeah.
And so the other thing, and you've discussed this on other podcasts as well, and something I know a lot of people have CPAP machines. What are your thoughts on those? A lot of people they have a sleep study, you have sleep apnea. It seems like they're just handed a CPAP machine.
Yeah, I got nothing against CPAP machines. Generally speaking, I do have something against CPAP machines that are used as a weapon, which is the situation that you're describing. So, and that's the typical situation. So let's just be real here, which is that, sleep centers that are the most common places for sleep apnea to be treated have zero connection, zero ability to do anything for noses. And so how that game is played is you come in with snoring, they do a sleep study. Sleep study shows you have sleep apnea. The only option they're going to give you is a CPAP machine. And add insult to injury, there are two routes that machine could use to push air into the back of your throat. You could use your nose. That means you need your mouth shut, or you could just put a full face mask on, which is sort of assuming that you're going to be breathing through your mouth. Um, all studies show that the best route for CPAP is through a nose that's open. Everybody there's that is, I mean, I don't like to use the term settled. The science is settled. The science is settled. And you don't have to, again, you don't have to be a rocket scientist to understand those concepts. Yet, by far, the most common masks that are delivered to folks who have sleep apnea are full face masks. Why is that? Because most people, well, let me sort of follow the ball here. 100% of folks who have obstructive sleep apnea, they have a throat that's too small for the body. That's where the condition is happening. Almost all of those same individuals have nose or nasal airways and sinus airways that are also too small for the body. And so, if people know that, but they can't do anything about the nose and sinus part of things, what they'll do is they'll just bypass the nose. So they'll put a full face mask on you. And I can guarantee that if you already have a challenged airway, the last thing that your body wants to see when you're trying to rest at night is something that's going over your challenged airway. So if somebody is already struggling to breathe, you're going to put something on their body, which is going to send red alerts to their brain that says we're struggling to breathe, and yet they're taking away our airway, even though the machine is trying to help you. So the machine's trying to help, but the system is sort of rigged against you. And so what ends up happening is 2/3 of people who are prescribed CPAP machines don't use them. Those are horrible odds. Like in what other situation in polite society would you accept 1/3 success rates? You wouldn't. I mean, it's abysmal. It's an abomination, and it doesn't have to be that way. And I guess what's the alternative? The alternative is, let's recognize the fact that we've got a throat situation if somebody has sleep apnea. Let's start them off with an airway that's working. When I say that, I mean, let's make sure their nasal anatomy is open. And then if CPAP is the right option for them, we're going to have them off on the right foot, and we will have their success rates, flipped around, where the success rate should be in the high 90% range if your nose is working properly. And then lo and behold, you know what? CPAP isn't the only option for you. There's another option, which is an oral appliance. And that oral appliance for most people who have sleep apnea would be a good candidate for an oral appliance. Almost nobody hears about that option. That option is sort of hidden away in the dental community. So if given the choice, more people would choose an option that's just more conducive for their lifestyle, which is an oral appliance. It's just unfortunate most people don't have that choice.
So you're talking about the MAD device, the mandibular adjustment?
Yeah.
Okay. So I want to talk to you about that too, because that was something really interesting that I heard you speak of before and like, this is where I'm at with physical therapy and the allied health professions and primary cares is there's no communication between the two fields.
Mm-hmm.
It's very hard. Like, I actually went with a patient to a surgeon's office to represent him, and they were like concerned that I was there.
I can picture it. Yes, I would imagine.
Yeah.
Yes. Yeah.
And they're like, "Are you his boyfriend?" I was like, "No, I'm not his boyfriend. I'm just his physical therapist." I'm like, "Okay." But anyways, uh, you're trying to bring the dental community and ENT together, it sounds like. And I think that's awesome. And I think that, the mouth, like we said, nasal breathing, mouth breathing, they're related. So what is it about tying dentistry in the teeth into the ear, nose, and throat?
Mm-hmm. I mean, we're neighbors, meaning that the teeth and the jaws, if you think about the anatomy in there, and you think about your upper jaw and those upper teeth and the roof of your mouth, well, that's the floor of the nose. And that actually is the key. We call it the keystone, the upper jaw. If that particular area is formed properly, your airway is likely to be nice and patent, open, all good. If that area is not formed properly, everything else kind of collapses down. And so it in an ideal world, it is a collaborative effort between the ENT community and the dental community to make sure that noses are open. And in my from my lens, is in as simple and effective as manner as possible, and make sure that throats are open, and same thing in as simple and as effective manner as possible. So that really does require the two specialties to work together in a way that isn't typical, but we're trying to kind of change some of that. The other dynamic too, and just to kind of go a little bit sort of deep on the dental side of things, is that in kids especially, but even in adults, there are ways to reconfigure the jaws. So you can use in a child, you can use what's called an expander, which is basically a retainer that goes in that's pushing the palate more open. So and when you push the palate more open, the teeth now have more room to live, and then the body has more room to breathe. And so that's something that is just massively underutilized. But that there's a perfect example of, if there was proper collaboration between these two specialties, then if as an example, if a child needed a turbinate reduction to make sure their nose is open properly, let's do that. And then if their jaws have formed where they're too small, let's make sure they get into a dentist that does the oral expansion so that their airway is more open. And then you've done, in a simple and elegant manner, something that will profoundly change the arc of that child's life. But that involves us being able to work together and be collaborative. That doesn't happen very often, unfortunately. I'm trying to change that. There is a wall. I mean, there's a wall between sort of, I call it the house of medicine. There's the house of medicine and there's dentistry, and it's on the other side of the wall. Here's how that works: is the house of medicine built that wall. Like the physicians built that wall. I'm trying to tear that wall down, or at least blow a door through there to reach my hand out to the dental community. Dentists would love to be able to kind of come through a door or a pathway so that we can work together, but they can't do it from that side of the wall. So, long story short, my folks have built the wall. I'm trying to tear that wall down. I'm one person. So I can chip away at that. But I think if I can get more of my ENT colleagues in particular to be recognized and be aware of these issues, they can join that sort of fight to kind of chip that wall down. And I think that's possible. That's not like a dream state. That's something we could do. What I expect is, over the course of my career, I expect that I will help to contribute to breaking that wall down and establishing that collaboration. And that will really just be the start of the next phase of things. And somebody else can kind of take the baton and carry it from there. But that's what I'm trying to get done.
And so, if people are having all these issues with their sinuses and nasal passages, should they be going to see a dentist too? And how do we know if we're seeing the right dentist that can do these things? Is there?
Yeah, this is where, unfortunately, it's a good question. It's a straightforward question. I'm going to give you my shrug, and the reason I can't give you a straight answer is the reality is, throughout this country, you almost have to get lucky to find yourself in a geography with somebody who's knowledgeable about these issues and can do something about them. And that's the truth. So, like I said it before, if you're suffering with these issues and you show up at your typical ENT's office, they're more likely to brush you off than they are to offer you something specific and helpful. If you show up at your general dentist's office who isn't aware of these issues, they will definitively brush you off. Versus doing anything. So you have to do the work of finding yourself or figuring out a way to get in front of somebody who is at least aware of these issues. And then you're likely, if you can get yourself there, then those same individuals are likely to be able to either do something to help you or to point you in the right direction and connect you with somebody who can. But you have to actively seek that out. You're not going to walk into your dentist office and and think, and don't, I guess, don't walk into your general dentist's office and think they're going to have an appreciation for these issues. Don't walk into your ENT's office and think that they are going to have an appreciation for these issues. Don't walk into your primary care's office. Don't walk in your physical therapist's office. Most people, most trained medical professionals, they don't know about these issues, don't care about these issues, and that's the truth. So I don't mean to be discouraging. I just mean to be real. And so, like, because I guess the last thing I want to do is put out a false sense of hope. And so somebody is hearing this and they have these issues and they think, I just need to make an appointment with my ENT and it's going to be all good. That's not true. You're going to need to do a little bit more legwork. You might need to do a little bit of travel. Like you may need to go a little out of your geography to find, either practice or a clinician who's able to deal with these issues. But and that's just the truth. I mean, unfortunately, it's the reality we live in.
Yeah. And so what about, the MAD device seems like something I've seen around. I tried one from Amazon. It didn't really fit. It was super uncomfortable. It like cut the inside of my mouth open. But are there certain types of dentists that do that, or like a training certification we could try to find one of them, or just
Yeah, I mean, so the over the counter those devices. I mean, if you get lucky, you might get it to work for a little bit. But
you need one fitted.
You need one fitted. So your teeth are very unique to each individual. And so there are precision, we call them oral appliance therapy. So precision oral appliance therapy devices that require a special type of scanning to get them constructed. So instead of like loosely trying to pull on your jaws, they're tightly fit around your teeth. And those work really well. There are certain dentists that can provide those sorts of appliances. There's a sleep dentistry board that if you look for those sorts of folks, those are the right individuals to help you there. We at my practice, we do those. We provide those oral appliances ourselves. So we try to make it as easy as we can for our patients. So you don't have to go find a dentist. Just come into us. We'll take care of the nose. We'll get you an appliance if that's the right fit for you. Kind of get you moving forward. But it isn't. I mean, we are where we're in the upper Midwest. Most, we're trying to grow as fast as we can. But I'd say most people, unless you live in sort of Wisconsin, Illinois, Indiana, Minnesota, we're happy to serve you. But if you don't, you're likely going to be better served by our dental colleagues.
And do you find that patients have good adherence with those devices? Because I've heard they can be quite uncomfortable as well.
They do. I mean, if you have one that's fit properly and you go through the titration phase, the compliance rates are very high. If you have one that's not fit properly and you don't go through the titration phase, the compliance rates are really low. So it depends on who you talk to, and that's the challenge. Is it's going to be almost impossible to know which appliance do you have, and so forth and so on. But it really, with the new devices, and they call them precision oral appliances because they are much more precise, down to the millimeter, like fraction of a millimeter kind of precise. Those are very highly effective, and so those work. I mean, that's the problem with a lot of things is there's sort of, in this particular instance, there's the over-the-counter things that don't work very well. There's the sort of kind of custom things that don't work very well. And then there's the true precision custom oral appliances that work very well. And most people end up with something in the first two categories. So when you talk to people, they're talking about, it's like apples to watermelons. It's like, no, you're talking about something you're putting in your mouth, but what you're describing and what you've been trying to use is something entirely different than the thing that we're talking about. So yeah, I mean, long story short, I'd say it's very highly successful for most people. The compliance rates are really high, given the right appliance.
Mm-hmm. All right. And seeing an allergist is another thing. So I went to my ENT. She basically told me, try this spray or these two different nasal sprays for 6 weeks. I did. It didn't do anything for me. I came back. We did a CT scan, and she did the endoscopy there. And then I came back. I said, "Yep, still can't breathe." She said, "Okay, well, you can see an allergist, but we could do surgery too. But I think you should see an allergist." And so I looked up things on allergists.
Yeah.
And it sounded like I want to stop the suffering now.
Sure.
And the allergist things I found online was, a lot of people were saying, I went, I got treated for these two different allergies that they found. I did it for 2 years or 3 years and it did nothing. Or
Yeah.
maybe it did help.
Um, I simply go back to, and this is my construct, so I'll forgive the ENT that you saw because they don't have this construct, but a healthy nose, nasal anatomy, nasal airways that are patent or open is another way to say that. So nasal airways that are open, sinus airways that are open, and a lining that's calm. The only way to get those passageways open are procedures. So in her hand, she has the tools in her hands to get those areas open. What is an allergist going to do? An allergist going to do it. An allergist cannot do anything to the anatomy, like zero. Doesn't mean they're bad people. It just means they're not surgeons. So that's just a reality. Where can they help the situation? They can help the lining. Now, how can they help the lining? The way that they can help the lining is with allergy shots or allergy drops, which, it's hard to say. I haven't examined you. I mean, I don't know what things look like, but I just heard what your supposed nasal airways sound like. Treatments are not going to fix that. That's an anatomy issue. I can hear it. So
Okay.
I mean, there are times where allergists can be helpful, but allergists can't do what they can't do. And so they can't treat the anatomy. So like in your situation, I guess another way to say this too is that if you had, so let's say you have both an anatomy issue and a lining issue. If that's true, then the sprays that she had you try should have helped to some extent, and because they're treating the lining. So if you try these medications that treat the lining, but they did nothing for you, then why would you go further down that treatment road to now get allergy testing, to do allergy shots, to try to treat the lining when you really have an anatomy issue? It doesn't make any sense. And so it doesn't mean you can't do that, but it just is a head scratcher as to why wouldn't you just simply get things open in your case. And this is where, and again, we don't kind of go, I can go in the weeds on a lot of things, but I'd say, most ENTs don't have that kind of clear paradigm that I do and my practitioners do. That paradigm helps us immensely because we don't like to waste time, and we don't like to waste our patients' time. And so sending people to do things that are wastes of times, that's not what we do. But in that, when you follow that paradigm, the other kind of reality is if you've got an anatomy issue, then there are things that we can do to open those things up. Most ENT practices don't offer office-based procedures to get nose or nasal airways open and sinus airways open. That's really all that we do pretty much in my practice. So for a situation like yours, our default thought process would be to listen to you, look at you. If you're a candidate to get the passageways open in an office-based setting, we'll do that and go from there. If things are so bad that we really need to think about surgery, we'll consider that too. But that's rare. And I'd say based on kind of the clues I'm putting together from your story, given what you're describing with your nose and what I hear, given the evaluation you're describing, given the fact that you have a CT scan, given the fact that the ENT is sort of hemming and hawing about whether to do something or not, I mean, again, without looking at you, without looking at the nose and sinus, I'd say almost assuredly, you would be the likelihood that you would be a candidate for office-based procedures to get your nasal airways open, sinus airways open is extraordinarily high. I cannot guarantee results, but I will say our results are consistently outstanding. I mean, if we find the right folks who have the right situation for us to put our expertise on, it's high 90% range where we get somebody, where they want to be. So anyway, I kind of going off on a tangent, but I'd say I don't. I guess the thing that the reason I'm kind of a little fired up on this one is because like the story you just described is the story I described to my practitioners as an example of a story that is the standard of practice, and it boggles my mind how my ENT colleagues can dismiss people like that. And I'm not speaking bad. I don't know her at all. I'm just saying that it goes back to the point I was making before, which is ENT as a specialty has blinders on as to the impact of these situations that people find themselves in. My colleagues have blinders on as to the profound impact that it has on somebody when they can't breathe properly, and I'm trying to take those blinders off, and someday I'll succeed. But right now, unfortunately, your story is the common story, and it's not a good one.
Yeah. And so, as we spoke before, a lot of people are looking to have these surgeries, like a turbinate reduction or a septoplasty. And a lot of people just, I've talked to, it's like a 50-50 draw of, hey, this worked really well for me, or it did nothing. It was
Mm-hmm.
a waste of my time and my money. So, one of my big questions too was, and one of the things they told me is, well, we could do the surgery, but we don't know if it's going to work, and those turbinates can grow back.
Um, 50-50 is not that 50-50. If you're having, let me just go this way.
That's just what it seems like to me.
Yeah, and I'm not I don't disagree, but that isn't the way it should be. Uh, these conditions are straightforward generally. The tools and technology that we have these days are extraordinarily effective. So it generally speaking, if somebody has, let's say, turbinate hypertrophy, and we adequately reduce those turbinates, it should be almost a never event where that person feels like that it's not what they were wanting, or those sorts of things. And as far as it going backwards, it's possible, but it's very, very rare. So, so I guess what I'm saying is what you're hearing is accurate to sort of it's accurate. I don't disagree with that. Those aren't the odds. If you're in the hands of somebody who is treating these conditions day in, day out, those should not be the odds. They just shouldn't. I mean, these are
But
conditions
but are
that,
they?
what's that?
But are they the odds? They shouldn't
Uh,
be, but are they?
I don't know. It depends on who you're seeing. I guess if somebody, here's what I'd say: if somebody's hemming and hawing about, it's all I can say is what kind of the feel that you're getting when you went in and got an evaluation. If somebody said to me, "Well, we could do something," it could come back. Maybe you should see an allergist. Is somebody who's trying to dance, and when somebody's trying to dance, they're not comfortable and confident in what they're doing. And I would say I would walk somewhere else or drive somewhere else. That is not the attitude that you should be getting from your surgeon. And especially,
No.
I guess, it's in this area. I'd say I can speak confidently in this area because I know this area because this is all I do. It's a different story. I can't speak about if your appendix is inflamed and maybe they're going to be hemming and hawing about this. But like this one's pretty simple. The passageways are too tight. The option is to get them open or don't get them open. If we do our job right, we're going to get them open. If things are open, how can they not be functioning properly? You know what I'm saying? Like if either you're going to get them open, or you're not going to get them open. And I go back to the paradigm. If it's an anatomy issue and you get the anatomy open, problem solved. If it's an anatomy issue and a lining issue and you get the anatomy open, well, we might have a lining issue that we need to treat, but at least we're off on the right foot. And we should probably treat that, whether it's with the nasal sprays or maybe we'll consider allergy testing. But there shouldn't be this sort of dancing around with this. There's not, period. I guess I'll end the sentence there because it annoys me because unfortunately it's the typical story. And I think that I simply cannot, like, I don't understand why that has to be the typical story. We have the tools, we have the technology, we can deploy them properly. There is a better way. So I don't understand why people still have that mindset. Meaning, when I say people, surgeons still have that mindset that they can't do something, and maybe in their hands they can't. But all I can say is the tools that we use and the techniques that we use are simple, reproducible, and effective. And there's nothing special about me. I can tell you that. But there is something special about a mindset and a framework that works and a process that works. So I guess back to kind of where I'm going with this is, human beings, there's all sorts of human beings. Physical therapists, there's all sorts of different physical therapists with
It's
all
good and
sorts of
bad.
different skill sets. Show me a physical therapist who's excellent in their trade, and you will be showing me a physical therapist who has protocols and processes that are reliable and effective and efficient, because that's how they're good at what they do. Show me a physical therapist who's bad at what they do, and they'll be hemming and hawing about it could be this and could be that, and they'll be reluctant to offer treatment. And I guess sort of my counsel to anybody who's listening is that when you're seeking help from a medical provider who is not confident in what they're doing, then go to somebody who is my strong counsel. And if you find somebody who's confident in what they're doing, maybe it's a false sense of confidence, so that's possible. But I'll say 100% of the time, if there's a surgeon or a therapist that is good at what they do and can deliver consistent results, they're using processes that are effective, and I'll trust a process over a person every day a week. So I guess what I'm saying in this particular instance is, people shouldn't have to go search around for like the special surgeon that knows how to get noses open. Find some place that has have processes that work, and they'll get you results.
Cool. Yeah, I definitely agree. I mean, it's the same of there's there's a lot of parallels between me and you of the physical therapy and ENT world. That sounds like because I have many of the same frustrations in our industry as well. Um, well, there was a lot there. I think is there anything else you want to add to this? We kind of got through everything I had on here. The only other thing I had questions on actually was um, you were one of the first doctors or the first doctor in Wisconsin to do the balloon sinuplasty. And this is something I asked my doctor about as well. And it seems like it's kind of the new big thing to be on the up and coming of the ENT profession. But I called the office that they sent me to, and they're like, "Well, we don't do it, but we'll refer you out for it if we can." I was like, "Okay." And then I asked her, she's like, "Nope, you're not a candidate for this." I was like, "Okay." But it sounds like this is something you do an awful lot. It's very helpful for people. Um, so on that side of things, like, is it much easy? I assume it's much easier to do a balloon sinuplasty than go in and cut someone's bone and soft tissue out.
Yeah,
It's much easier for
absolutely.
you, the patient.
Right.
How many people like qualify for these things, or can we make more aware of these things? Because it doesn't sound like, from my short search on the internet, there weren't a lot of providers around me that are doing it yet.
Yeah, and you may not know the answer to this question. Was the ENT that you saw, was that ENT employed by a hospital or hospital system? Do you know?
Ooh, it is. They're part of. So it was. They're part. It was Lowell General Hospital, which is now part of. They could just got bought up by Tufts.
Okay. So
So
to me that says highly likely that they are. So here's the dirty little secret I'm going to reveal right here.
I love it.
If you are seeing an ENT who is employed by a hospital system or an academic medical center, they are not allowed to offer balloon sinuplasty in the office. So
Ooh.
they'll tell you you're not a candidate. They'll tell you so forth and so on. They'll tell you they'll refer you down to somebody else, but they're not able to offer that. And and then it's like, well, why would that be? And here's the deal: is because those hospital systems they want you in their operating room because that's how they generate their
Money.
revenues. They don't generate their revenues by doing a procedure in the office. So that's the deal with balloon sinuplasty. I can't tell definitively whether you're a candidate or not based
Yeah.
without seeing a CT scan, but I'd say the fact that you've been told that you're not a candidate does not, in fact, mean that you're not a candidate. It just means that you saw somebody who can't offer it, and therefore is going to diminish it as an option. So what I will say definitively is if you have sinus airways that are not working properly, either you're getting recurrent sinus infections, chronic sinus infections, so forth and so on, then you have an anatomy problem. Those passageways are not open. There are two ways to open the anatomy. We can use a balloon, which is what we're talking about, balloon sinuplasty. We can find the natural sinus passageway, take a balloon, place it in that passageway, inflate it to dilate the opening, deflate it, and take it out. So we've opened the passageways without removing any tissue. We haven't made any cuts. It's a beautiful, elegant thing. The alternative option would be to take you to surgery, get you to sleep, and do sinus surgery. Sorry. What does that look like? With that, we're actually, still elegant, but we're cutting and removing tissue to open. So instead of dilating the passageway to open, we've got to cut bone and soft tissue to open things up. If you're a candidate for either one of those things, which option do you think most people would choose? They would choose the balloon option. Unfortunately, most people are never presented that option. So, sorry, it's similar to what I was saying with the CPAP and the oral appliance. It's the same dynamic here with balloon sinuplasty and sinus surgery. If you see somebody whose only option is to offer you surgery in an operating room and cannot offer you balloon sinuplasty, you will not hear about the balloon sinuplasty option. In fact, what you're going to hear is, that doesn't work. It's kind of new. It's experimental. I don't know. I've seen some people who didn't get great results with it, and so forth and so on. And all of those words are a lot of, verbiage around, I can't offer that to you. I feel weird about saying that to you. I don't know if it works or doesn't work because I don't do it. But that's what I'm going to say to you. And I don't know. I mean, I'm getting, older each year, but I did the first balloon sinuplasty case in Wisconsin in 2006. 2006, George W. Bush was president. This is before the iPhone, before the iPad. I seem to think this is around the time that, Google was just sort of becoming something. Facebook, what I'm saying? Like, that's a lifetime ago. And so for my colleagues to have the gumption to say that this is new and experimental is a mind-boggling, head-scratching situation. And yet here we sit in 2023 with technology that's been around for 20 years that people find new and fascinating. Again, if you want to sort of understand why the healthcare system is screwed up in so many ways, follow the ball and some of the things we're talking about, and you'll see that the system isn't built for you as a patient. The system is built for the system, and the system will do whatever it takes to keep the system going. And you're just sort of you're kind of the fuel that they throw in to keep the thing going. But nothing is built for you. And so I guess that's where, like, I got a lot of things that get me going, but this one is another one where it's like, no. Like, I guess like let's sort of speak truth and knowledge to things. And in this situation, I'd say, yeah, balloon sinuplasty is not magic. It's not the panacea. It's not going to it isn't, something that it isn't, but it's a simple, effective tool to get sinus airways open that works, and it works consistently. And all studies have shown that, and nobody questions that. And if somebody's suffering with conditions in the sinus areas, then it's either an anatomy problem or a lining problem. And in the sinuses, it's actually a little bit more clear cut. In those areas, from a treatment option, the primary treatment option is to get the anatomy open. There isn't much we can do for the lining in the sinuses because if the anatomy is shut, you can't get medications to the lining. So it's almost even easier than the nose. So it's like, well, let's get the anatomy open. And then it's like, well, why don't we get the anatomy open in a simple manner, like with a balloon? And then maybe and then I'd say, well, you know what? I'm just going to, I guess my general approach with medicine is I have sort of strong beliefs, but they're loosely held. And again, I'm not, at the end of the day, I am not the decision maker here. You're the decision maker. And so I'd say, hey, why don't I put these options in front of you? And why don't I have you tell me? I'm going to educate you. I'm going to tell you if they're valid, both reasonable options. I'll tell you that. If one is a little bit better than the other, I'll tell you that. But lo and behold, if you present with an even hand or with even hands for somebody who has sinus issues, these two options, almost everybody, like I'd say 99% of people, are going to choose the office option because you know what? What if it doesn't? Worst case scenario, what if it doesn't work? Can we go to surgery? Yeah, we can go to surgery. Well, why wouldn't we try that option before we go to surgery? That's right. Why wouldn't we try that option before we go to surgery? That's what I would want. That's what I would want done unto me. That's what my wife, my parents, my kids, same thing. That's what I mean. But yet, it still isn't widely accessible still, 20 years later.
Mm. That's crazy that we have these obstacles and road bumps in practice that just don't seem to make it easier for our patients.
No, it is.
So
Absolutely.
I'm sure the insurance companies don't help with that to make things easier for patients and more cost effective either.
They don't. Although I mean, honestly, we as a practice fight those battles with insurance companies on behalf of our patients. In this situation, I mean, how do you say this? I mean, um,
Toe the line.
well, no. I mean, I think in this situation, isn't the insurance companies so much that are getting in the way of progress? It's the system. It's actually my ENT specialty is what's getting in the way of people having access to balloon sinuplasty. Because from an insurance standpoint, most insurers who kind of get it and say, "Gosh, here's two options. We can have this person do an office procedure. We can have this person go to surgery." It's much more expensive for everybody to go the surgical route. So insurance companies would prefer the office route. The problem is they just don't have that much access to practices that offer the office route. So most sinus surgery that's done in this country, when I say most, I mean 95 or higher percent is done in the operating room, no balloon, just, standard old techniques. So for people who are fortunate to have access to all practices that offer balloon sinuplasty, insurance companies generally are good with it and will approve it, which is a good thing. So, I think various aspects of the healthcare system are messed up. And then I think if you're going to look to make a difference, you just need to figure out what specific part of things is messed up. And then, for me, tend to be a disruptor. And then it's like, okay, that's the target. That's what I'm going to, sort of identify and push out of my way. And so in this instance, it's not the insurance companies who have an issue. It's not my patients they have an issue that we're trying to treat. It's my colleagues, the ENT colleagues who sort of are trapped in hospital systems that want to keep them stuck back in the 20th century. We have 21st century medicine we can apply, and so and again, I'm not my job in life is not to convince all my ENT colleagues to do the right thing. It's to do the right thing, show them that this is the right thing, and then I do believe when they see what happens when you do the right thing, which is you get good results for your patients, that more of them will follow. So that's my hope.
One more question for you.
Sure.
Fitness wearables and sleeping. I just had an advocate, or she sits on the council for Whoop, Allison Brager. She's my sleep neurobiologist. She's awesome.
Uh-huh.
But we talked about a lot of different things as far as tracking sleep and everything. As far as sleep apnea, like I said, like I've got my Apple Watch. I've been doing some, listening to my my rather not restful sleep. Can you is there anything you can do to kind of do your own little self sleep studies to see if you might have sleep apnea before going and or any inklings you would get from some type of fitness wearable? Like I know the new Apple Watch, I don't have it yet. It actually tracks your O2 saturation.
Right.
So
yeah, that would be that's what I was going to say. So the Apple Watches that do that, I wear an Oura Ring that does that too. If your oxygen sats are dropping, if you have an accurate way to measure your oxygen sats and your sats are dropping when you're sleeping at night, you have sleep apnea. It's not a definitive diagnosis, but that's what's going on. There's no other reason your O2 sats would be dropping in that situation. There's many ways to track snoring in particular. So, if you're snoring consistently at night, the likelihood of you having sleep apnea is significant. Home sleep tests these days are super easy. Almost easier than wearing a watch. I mean, there's a sleep test that we'll offer our patients sometimes. That's just a little device that you tape on your finger, and it's a sleep study. It'll give us all the information we need. So we're talking about it's kind of what I was saying before. Technology has come a long way, and even whatever you want to call it, insurance covered medical FDA approved sleep tests are super slick these days. Give us all the information. So I guess what I'm saying is if you're struggling, if you're snoring, you you know getting into a place that can get you a home sleep study in a simple manner is worth doing. You can continue to gather data on your devices, and it'll help, but it will likely just be confirming that, if you're snoring every night, okay, some nights are better than others. It's just cutting to the chase and getting the true knowledge about what's going on, so that you can do something about it is the bottom line.
Hmm. Okay, cool. Well, thank you, Dr. Kandula. This is a very informative podcast. I got to say, I love your passion for this stuff, and getting into it with me has been pretty cool because there's a lot of parallels too, and a lot I think we both see um, between seeing patients and things they're dealing with that no one else is looking at or bothering to look at, as well as just, this is another great way and another great resource for patients to have that are maybe in similar shoes to mine, where I feel like there are a lot of people in similar shoes to mine that haven't gotten treated the way they want, and maybe went to the doctors and just like me, who is an educated medical professional, and
Yeah,
I'm
right.
still questioning like what I'm supposed to do now with the way the information was given to me and handled, and it's a scary thing for me to think of patients that don't have a 7-year doctorate degree
Hmm.
into a medical office
Right.
and try to make sure they're doing the right thing for themselves. That's going to benefit them in the long run.
I
So,
agree. I mean, that's the thing. I mean, I mean, I'm fortunate to have my education and be knowledgeable, and obviously, I'm, in the specialty that I'm in. But I guess me seeing and hearing, secondhand, firsthand, sometimes the stories the struggles that my patients go through, just very much the same that you're describing. Um, Makes me wonder how somebody who doesn't have the benefit of that medical education has any chance in this system. I really, and I don't mean that to be discouraging. I just mean that to be honest. And to me, it's just proof positive of kind of how dysfunctional things are, and how important it is for each individual to take hold of their medical fate. Because if you don't do that, like if you go, and this is what I think most people who go and touch the healthcare system do so still in a trustful manner, in a passive manner, and that that's just a recipe for disaster. And so the way to approach the medical system is in an active manner and with a sort of determined mindset, that if you've got a problem that you're looking to get a solution for, that you keep going until you get a solution. And if it doesn't feel like you're getting the right information, finding somebody who can get you the right information. The challenge is sometimes that's a long drawn out battle, and most people are worn down, in the first round with some of that stuff. And I get it, but I think the challenge, and I guess as much as, I mean, when I think about it and I talk about it and dwell on it, it's really depressing. When I instead focus my efforts and energy on doing something about it, which is what I get to do on a daily basis, it's energizing and invigorating. And so while I need to recognize the reality of the situation around me, the good thing with what I'm doing and with what you're doing is that you can, one step at a time, one patient at a time, change the system in a way that sort of pushes it towards the positive, which is it's all we can do, I guess, is sort of the bottom line. And I guess things like this, though, I'd say we can do good work on a daily basis, but then I think providing people with good information, or maybe some thought provoking information, so that they can go, to me, I sometimes will kind of think of about it is if I can inform people and arm people with the proper information, they can go out and be a foot soldier along with me to fight some of these battles. And I think the battle that I'm fighting on the breathing triangle and these airway issues is just merely one battle amongst all the different battles that exist within the human body about, mental health, physical health conditions that need to be treated. But if I can push on this one and I can get other people to recognize how messed up things are, and they're pushing too, I think we can tip this thing over. And then I think you can just kind of keep going, marching on to the other, whether it's physical therapy or orthopedics or other things that are, I'm sure, similarly just as screwed up.
yeah, absolutely. So we'll cut it off there at an hour and 38 minutes. But Dr. Kandula, where can people find you and your practice and your social media stuff too? There's a lot of good stuff on there.
Yeah, adventknows.com is my practice. So Advent's a medical practice, Advent Knows, either way, KNOWS or NOSE is the medical practice. I'm most active on LinkedIn, so folks who use that, it's just under my name, so Madan Kandula. I don't think it's live yet, but we're aggregating some of my social media stuff onto a personal website. So Madan Kandula, so MADANKANDULA.com. So that should be live, any day now. So any of those places, and hopefully this was some good information.
Yeah. And we'll be sure to share your contact stuff in the show notes there. So again, thank you for coming on. It was a pleasure having you. And you know, I hope I can figure out my nose here. And now that we just took about an hour and a half to do a differential diagnosis on me. I think I feel a little more confident about what I know and don't know now. So thank you.
Yeah, absolutely. No,
All
and
right.
I think, and we're off, right?
Give me 1, 2, 3, and off.
Did I screw that up for you?